how safe these calcium supplements are. So any patient going to a doctor, so with a joint pain or a bone pain, so generally doctors say that they have the calcium deficiency and they advise these calcium supplements that to lifetime, especially in elderly patients with or without symptoms. Doctors prescribe these calcium tablets to take regularly every day. Again, in ladies, that is in females also, doctors keep advising to take calcium supplements regularly, saying that so again the ladies will be having calcium deficiencies. How safe these calcium supplements are? Do we actually need these calcium supplements? How dangerous, how harmful these calcium supplements are? So first thing is, so whatever the food we take, that will be having the nutrients. That nutrients will be carbohydrates, proteins, so fat, vitamins, and also the minerals. Our body will be having more than 100 minerals. So among them, calcium is one of the minerals. So this calcium we need for our bone growth, teeth, as well as the muscle. Muscle development also requires this calcium. So along with this, hormones as well as enzyme formation within our body, as well as each and every cell of our body, to some extent they need this calcium. So based on this, the calcium level of our body should be 8.5 to 10.5 milligram per deciliter, and everyday requirement of calcium is around 1000 to 1300 milligram per day. This is true in case of children's aged less than 21 years. So because at that age the calcium requirement will be so more, that is around 1000 to 1300 milligram per deciliter, because the bone development will be there, some muscle growth will be there, teeth formation will be there up to the age of 21. You need to remember two things. So first is, every food, whatever the food we consume, will be having certain amount of calcium. Even if you eat only rice, that rice will also be having a calcium. So not only the rice, any fruit, any vegetables, any grains, any dal you eat, that will be having calcium. Not only these things, even water what we drink will also be having the calcium. Second thing is, as the age advances, our calcium will be low. So it's true, but it's a normal. See, because the requirement of calcium after certain age, after the age of 21 will be less, because so bone, muscle as well as the teeth will be completely grown, completely developed by the age of 21. So after the age of 21, the requirement of calcium itself reduces. So adults will be having decreased requirement of this calcium. So one more thing is, the adults or the elderly people will be less active. So when they are less active, the muscle doesn't need more calcium. So requirement of calcium will be low, especially in case of elderly people, and that is absolutely normal, because the need of the cell, need of the body itself is low. So in case of elderly people, the requirement of calcium is low, so the calcium level in the blood will be less. Still, if these elderly people start taking the calcium supplements, then what is going to happen? So first thing is, this calcium will affect every cell of our body. So mainly it affects the kidneys. So calcium supplements can result in chronic kidney disease, first thing. Secondly, it can also result in kidney stones. Kidney stones will be more frequent among those who consume the calcium tablets regularly. So along with this, the joint pain as well as the bone pain, it's mainly because of hypercalcemia. High calcium level causes this pain rather than this low calcium level. Third thing is, saying this calcium is the need of a muscle cell. The excess of calcium affects our heart. Heart is also a muscle. So excess of calcium will affect our heart, resulting in irregular heartbeats. This calcium causes vasoconstriction, which can result in blood pressure, increase in blood pressure, and higher level of this calcium will have the high risk of. There are many studies which say that higher level of calcium, that is hypercalcemia, can result in heart diseases. Heart diseases like chronic heart disease, even the heart failure also. So this calcium will also have an effect on the cells, nerve cells, so resulting in irritation as well as swing in the mood, depression also. Depression is also one of the most common complaint that we see in case of hypercalcemia. So calcium supplements are not safe, they are very much dangerous, so it's better to avoid taking these calcium tablets. Then what to do if you feel or if your blood level is showing a low calcium level? Even then you need not take the calcium tablet, because almost all the food what we eat will be having the calcium. Just we need to balance it. Like, so what are the food which have higher level of calcium, more calcium, you can use more such vegetables. So like for example, green leafy vegetables will be having more calcium. Cabbage, okra will be having more calcium. Then broccoli as well as the green leaves like spinach will also be having the more calcium. So consumption of these vegetables in larger quantities will help you to correct your hypocalcemia. Along with this, certain fruits like orange and papaya will be having higher level of calcium levels. So if you feel that your calcium level is low, or your blood level of calcium level is less, it's around 5 or 6, then you can consume these vegetables, these fruits in more quantities, and you can correct it so naturally without going for any supplements, because supplements are the chemicals, they are not natural, they are all the chemicals, they passively diffuse. The calcium that is there in food gets actively absorbed. So whatever the quantity of calcium that our body needs, only that much gets absorbed, and remaining calcium in the food gets excreted. But when we consume the tablet, it passively diffuses into our cells, resulting in hypercalcemia, affecting our heart, affecting our brain, as well as affecting our kidney. So it's not safe to take the calcium tablet even if you are suffering from hypocalcemia. If you need precise and scientific information about health, then only you subscribe to our channel. Namaste.